and, and particularly those who are poor and marginalized in different parts of India. As we know, when this very pandemic struck, the very beginning itself, one of the most touching and harrowing scene was the long queue or the long walk of the poor and marginalized migrant workers from the big cities at the beginning of the lockdown, walking hundreds of kilometers for safety. And they were the people whose lives and livelihood were dramatically affected by the lockdown. And we know that in our own neighborhood, I know personally how people are indebted, they lost jobs, many of them lost lives. So when we say livelihood, means a large number of people, more than 75% of the people of this country work in the informal sector. Many of them work on daily wages or weekly wages. They work in micro enterprise, small shops, small scale industries, agriculture sector. Many of them, if they don't get job for 3-4 days, they get into a poverty. Almost all the data shows poverty has increased in a dramatic way in India. Poverty, hunger, and malnutrition. Today we have three eminent speakers. Vijayanand sir is the former Chief Secretary of Kerala, but he is also somebody who's led a lot of work on, strengthening livelihood, poverty eradication, local governance, and rural development in a civil service, in a very stellar civil service career spanning over many decades. Welcome to Vijayanand sir. We have Professor Sunny Jose, who is a Reserve Bank professor at Center for Development Studies in Hyderabad. Sunny has taught in Tata Institute of Social Science, Birla Institute of Technology, and so many other research institutes. Sunny has done extensive work on poverty, malnutrition, hunger, etc. We also have Sonia George. Sonia has been working with women rights, particularly with women workers, as an activist of SEWA and a leader of SEWA, Self-Employed Women's Association. So thank you, everyone. Given the, Professor Sunny Jose has a special request, he also has a little bit of, clash of schedule. So with, I would request all others, we were planning to have Vijayanand sir. Sir, can we have Sunny Jose and then, your presentation?
Okay, that's fine.
Yeah, because Sunny later on told that he got a clash of program. So he will be with us till 5 o'clock. First, we'll have Sunny, then we'll have Vijayanand sir, and followed by Dr. Sonia George. Thank you very much. And I would really, I like to welcome and appreciate each of these eminent panelists. All of them have direct experience of working on people who are marginalized, who are at the receiving end of poverty and discrimination, and this is the most important thing. And this is a part of a research work. I mean, that we are doing this series. The first series was on the impact of COVID on economy. We had eminent economists across the country, and also we had participants from 10 states, including our postgraduate, students from across the country. The next in the series will be the impact of COVID on public health and public health systems. And all these things are a part of our own ongoing research, which will include empirical studies, case studies, and analysis, which will bring together knowledge initiatives and policy suggestions that will help policymakers and also help civil society, private sector, and the government to take appropriate measures to address issues to economy, livelihood, and public health systems. With this, may I request Sunny Jose to begin his presentation. We'll have around 15 to 20 minutes presentation followed by discussions. So totally we have allocated up to 30 minutes. So it's up to each of the panelists. How would you like to use this time? And thank you very much. So may I request Professor Sunny Jose to start the presentation.
Thank you, John. Thank you so much.
Yes, Sunny Jose, welcome.
Yeah, I'm not able to share my screen.
No, you can speak. Sometimes
Okay.
the problem with many of us are on, phone. Unlike, if you are on a website or if you are on a
There you are. No, I'm.
You got it?
Yes.
Yeah, we can see you.
Yeah. Okay.
COVID with their food and nutrition security. Yeah.
Yeah. So.
Yeah, sorry,
how
you are from
COVID
Council for Social Development,
Yes,
See.
Council for Social Development, Hyderabad.
Hyderabad. Yeah,
Yeah,
thank you.
that's okay. Yeah, thank you, John, and thanks indeed for this opportunity, and also for the help in allowing me to present. First, I'm really sorry for the inconvenience caused to Professor Vijayanand sir. Okay, so basically, I will set the context that what has happened to food and nutrition security because of the COVID-19 related lockdown and the kind of disruption that has happened in the economy and in the food and nutrition security. Okay, now we know that there was a lockdown which was actually abrupt, without any notice and ill prepared. Now the economic survey said a hosanna and hailed us this is based on evidence and humane. Now, what do they mean by humane? Actually, because then you have to look at what is the meaning of the humane. But many commentators actually refer to us as it is brutal, which is exactly the opposite of what the economic survey claimed, and refer to the fact that perhaps it's the harshest of all the lockdowns that being imposed in all over the world. So which led to the disorder, distress, and death. Now, exact number of people died, we really do not know, but there are some what is called informal estimates which are available. Now, the Oxfam study actually referred to that. It is perhaps the biggest migration ever happened in India after independence. Now, over 10 million people walked. 10 million people walked for hundreds of kilometers on foot, without any food or preparation or anything, because the transports were disrupted. So the interview by many, one of the reporters actually interviewed that people who traveled, he really succinctly put that what is called Hobson's choice. What is that Hobson's choice? Either we stay in our place and without food and die, or we leave and reach our home and in the process we die. So effectively the what is called the outcome is actually the same. Now, that was the first lockdown of the first wave, and which led to a kind of hubris. And the same economic survey, which came immediately after that, claimed that India was the only country in the world, other than Argentina, that has not experienced a second wave at all. So kind of hubris actually, that it claimed it. It's an official document. I'm quoting from there. Now, we know that everyone went on talking about that we flattened the curve. We are able to provide vaccination for the whole world. A lot of this kind of statements which came up. Now, then came the devastating second wave. Now, which actually many refer to as a humanitarian crisis, not only in terms of health infrastructure, not only in terms of like an aspect which are needed for the very survival, including oxygen, the entire economy and the livelihoods got disrupted. So therefore, all these things to sum up seem to have a huge, a long-term impact on food and nutrition security, which we all know. Now, how do they specifically impact? I will actually like kind of point out a couple of means that they may have, that they will actually impact the food and nutrition security. Now, this lockdown and the associated decline in employment and the host of other measures affect food and nutrition security in two ways. Now, one, there is a clear loss of income. Second, reduced access to food and lower dietary diversity, because food which were really available were not like an available, and also the quantity which is not available, and the income which is not available to buy the food. So therefore, what would happen is actually the households tend to switch to low quality diets. Now, this is very important. In India, the anemia and what they call the micronutrient deficiencies, or what is being referred to hidden hunger, the prevalence of that hidden hunger and anemia is quite large. So that is despite having access to the food, like having access to the food, some sort of a diversified food. Now that like this is an quality diet. So this is also the time that reverse migration happened, that migration back to their homes. So loss of livelihood and income also happened. So therefore, what happened was very clearly a coping mechanism was reduced food intake. Not only they resorted to low quality diets, second, they like resorted to reduced food intake during that time. And when it comes to nutrition related services, it was very clear that the ICDS and Anganwadi centers and the midday meal centers were all closed because of the lockdown and related measures. Maternal and child health services were clearly disrupted. The health staff which were working on maternal and health services were actually diverted to COVID for genuine reasons. So all these things have huge and adverse impact on children and women in general, and poor women and children in particular. So which actually like many people refer to as impending undernutrition crisis, which may even reverse the progress. We'll see that what has happened, because there is now data available to look at that. So many people refer to that. So there is a possibility of an impending undernutrition crisis is likely to happen, and which will reverse the progress that India has been registering in nutrition security or nutrition indicators. Okay, so let us see what has happened. Now, the state of food insecurity report brought out by FAO, like Food and Agriculture Organization based at Rome, clearly says that India is a home to 25% of food insecure people in the world. 25% of the world food insecure people actually reside in India. Now, this is despite the fact that like the godowns of Food Corporation of India houses more than 100 million tons of food grains. And in fact, some estimate they said that the food grain, they very clearly specify. So there is a clear contradiction. 25% of people are food insecure. To see, not a mild. Moderate to severe food insecurity increased from 31% in 2019 to 38% in 2021. So there is a perceptible increase. Now, we also saw the debate about global hunger index 2021, which actually ranked India far below, even in some of the some of the South Asian countries, and we our rank remains more or less same, that we have not had any improvement. In fact, 2021 rank, there was a slip in the 2021 rank. Now, what has happened to income security? That I quote the authentic surveys done by many of these what is called reputed organization. 8 out of 10 workers out of that, like 5,000 workers informed, being surveyed by Asim Premji University, said that those who are working in informal sector reported loss of livelihood. 70% of regular, salaried, and casual wage workers reported loss of employment. So this is coming from a detailed survey of more than 5,000 workers span across multiple states by Asim Premji universities, like in the Center for Labor. Similarly, National Institute of Urban Affairs survey clearly says that 91% of urban poor households reported some form of loss of livelihood. And Indus Action survey, like of more than 5,000 households, clearly revealed that 48% of households lost livelihood in one way or other. So there is a clear consensus emerging that the income security has been very severely been affected during this, like in a lockdown and related measures. Now, in fact, if you go very specifically to the what is the magnitude of income change in real earning, if you look at that, self-employed people had a decline of 18% in average or median income, followed by temporarily salaried people and permanent salaried and casual daily wage workers. So it is very clearly like coming out in sector wise at the multiple survey wise. Now, if you go back to intake, now we saw that what has happened at the global level. Again, Asim Premji, like in a report, very clearly says that roughly about 20% of the households never recover to their old food intake, and it is much higher in urban. 28%, more than 1/4 of the households never like got back to the kind of food intakes which they had before COVID. And complete recovery, if at all complete recovery, that you have to only look at that kind of like see, look at that this. So if we say that partial recovery and no recovery, which is actually close to 50%. In fact, all India level 40 plus 20, 60% had either no or partial recovery. Okay, now actually very interestingly that like in a Dreamsy, Andres and Somanchi has reviewed the kind of like the multiple surveys which reported this, like I took from there like an article, says that like an income reduction by several others were ranging from 42 to 74, like because it is actually April, May, July, September, it all like goes up to 42 to 78%. That is for agriculture. Now again, a survey which is representative and also like covered more than 5 states clearly says that at least one member experienced loss of earnings is 96%. And reported less variety of food available for consumption, 95%. Reported a lower quantity of food available for consumption, 87%. So these are all like telephone surveys carried with large number of respondents coming across multiple states. So I selected very carefully, reviewed more than 30 to 40 articles, surveys which are representative. So that what has happened as a policy says, yes, the government did something. So doubling of rations under PDS, 50% expansion in Mahatma Gandhi National Rural Employment Guarantee Act, and also increase the pension, and particularly Jan Dhan Yojana, that scheme that like a direct money transfer has been actually like effectively been like transferred. So therefore, to bring to the fact that yes, they had some impact. So there is no denial on that. However, all these interventions cover only a fraction of the income lost. You look at that, like go back to that, like 97% reported their income lost, and the like loss of income varies across the households. And till now, to my understanding, there is no robust assessment of the magnitude of livelihoods lost, what is the extent of livelihoods lost among the poor, and so on. Now, if we go back to nutrition, from food insecurity nutrition, like an NFHS 5, National Family Health Survey 5, conducted surveys in 17 states, phase 1, and I have actually given the date of survey, November 19, February, all these things. Now, if you look at that, the yellow color, in all these states, stunting, a crucial indicator of child nutrition. And in fact, one of the, like, many economists predict that it's actually an indicator for the longer life, because stunting, the adverse impact of stunting will have for at least for 3 generations. Look at that, like, out of 17 states, 1, 2, 3, 4, 5, 6, 7. So roughly about 10 states had experienced an increase in stunting before the COVID. Phase 1 was before the COVID. Now, phase 2 was actually held after the COVID. That is 2020-21. Now, there is something really remarkable. All the states experienced decline in stunting, which is actually counterintuitive, that there was a very clear reported case of loss of livelihood, especially among the poor. Health services were disrupted, and now we see that the post-COVID survey of the phase 2 clearly bring out the fact that, like, stunting has actually decreased, not increased, contrary to the phase 1 survey which it held. So then, if you look at wasting, another crucial indicators, which is actually what is happening now in, like, influences, same holds good, that most of the states where survey was held in the phase 1 before the COVID, that we see that wasting has gone up, whereas in all the states the survey was held after the COVID, the wasting has gone down. So there is a clear contradiction. But anemia has increased both among children and women. So therefore, what we look at in nutritional indicators is a mixed picture, that there was a deterioration before the COVID and there is an improvement after the COVID. Now, the question here is that why stunting and wasting increased before COVID-19 and decreased after COVID-19, which actually contradicts with the surveys. I reported that very carefully selected surveys, and also, yes, a broad spectrum of surveys actually very clearly says that, and the results of nutrition clearly contradicts. So therefore, like, it is too early without looking at the minute level data or the unit level data of what has contributed to the increase and decrease, like, before and after the, like, this COVID. So we cannot actually arrive at a kind of conclusion now. Therefore, so a detailed required, like, an analysis is required. So to sum up very clearly, that the studies point out that there was a deterioration in income security, food security, but nutrition security, it actually gives a kind of mixed picture. So thank you for your patient hearing. I stop here.
Thank you very much, Professor Sunny Jose, for this excellent presentation with facts and figures and data, and the latest data available. Both, you have used government data, the National Family Health Survey, as well as other data, especially the one done by Asim Premji University, and you have used number of data sources to make that the most important point. And thank you very much for the presentation. If you have any questions to Professor Sunny Jose, either regarding the data he presented or the overall argument, this is the time. Please, the floor is open for a few minutes. Anyone, those who would like to ask questions about this whole issue about food and nutrition. And food and nutrition is a very clear indication of also Sustainable Development Goal, 1 and 2. It is first is on hunger and then on poverty. And on those things also, it very clearly shows, the claims or the promises and the performance are very, very varied. So any questions?
Yes, sir. Yes.
Yeah.
Sir, I have a question, sir.
May please introduce yourself and ask the questions. Yes.
So my name is Kashyap, sir.
Yes. Yeah.
I have been part of ISDG intern. So I have done a data collection on livelihood, impact of COVID on livelihood. So I've been collecting data of what are the precautions or the counter things to do to rectify the problems of migrant workers. So I have gone through a article where MGNREGA will be a good initiative for the migrant workers who have returned back to their home. So Kerala was one of the most state which employ the migrant workers more. So it was, so the workers who went back to their home was like they were asking for MGNREGA like work for 100 days. So but then also the article was showing that there were work, but they were not paying the wages accurately. And there was also they also mentioned one thing like one country one card system, like for PDS.
Ration card.
So
One
still
nation,
it
one.
is, yes sir, still that is also not sufficient, that is not also fulfilled for migrant workers. So what will be the what should a government do for this kind of migrant workers who have been marginalized from all of the section, even though they went to their home or their native, still they are facing um, such a big blow for their lives and livelihood. So what even though Abhijit Banerjee have been giving um, um, some precautions or something, propose some ideas about increasing the MGNREGA provisions for migrant workers. So why does it is like being, it is not still fulfilled? That's why
No, I will actually like in a okay, Kashyap. I will raise an important substantive issue here, because it is not what about that, what precisely be done. Because like before the COVID, there was a kind of intellectual discussion which has been happening in discrediting the PDS and also Mahatma Gandhi National Rural Employment Guarantee Scheme. So if you look at that, like so there was a kind of what is called like romanticism with the direct cash transfer. People were saying that PDS was inefficient, PDS cannot function, there was corruption, and so on and so forth. So there has been a very like what is called like an academic discrediting of the PDS happened. Second, there was also like a kind of the debate, which is actually like leading to the weakening or the lesser commitment of Mahatma Gandhi National Rural Employment Guarantee Act. So you look at that, like what actually stood the test of the time when the crisis happened. In fact, PDS actually stood the test of the time. PDS reach was very clear. People were depending on that, and people were really depending on Mahatma Gandhi National Rural Employment Guarantee Scheme in the rural areas as a lifeline. So therefore, like what needs to be done, like in fact, like had we actually strengthened the PDS and in National Rural Employment Guarantee Act, actually the thing could have been much better, like in the kind of like in a relief measures that we could have happened. Actually, the effectiveness with which the relief measures could have like reached out could have been much better. So therefore, because the crisis that was happened about the migration was like an unprecedented, therefore it is not really possible for any government, be it the like in central government or the state government, to come to grip with the reality and the nuances. Therefore, it's actually we cannot blame the government to saying that like they actually couldn't do that. But what we can say that what has been happened before has contributed to the what is called the vulnerability of that. So I will stop here. Thank you.
Thank you very much. Actually the time is up. If you have any more specific questions, you can ask. Otherwise, we'll go to the next presentation.
Yeah.
Thank you, Sunny. I know that I mean, if you come back, if you have time after your sessions, please come, because we also hope to have a final discussions and after all the presentations. Thank you very much.
I'll try. Yeah. Thank you so much.
Now, I would request um, Vijayanand sir, and who has been with the government, but also who has been a great supporter of civil society initiative on issues to do with livelihood and poverty, and also he has been a champion of the local self-government, etc. May I request Dr. Vijayanand to make the presentation?
Thank you, John. First of all, just the background. Now, of course, it's more than a year and a half since we had that terrible lockdown, when really the poor were locked out of the economy and their livelihood. And when you look at, it's been in the making, not just COVID kind of pushed it. Fortunately, the only fortunate thing was agriculture survived and survived very well. And agriculture protected the nation from a worse crisis. But all other sectors were really hit. That is beautifully presented earlier. So I will not be going into it. And how did we reach? Of course, there was delayed response and thing, but over the years, equitable development is no longer in the political or intellectual discourse. And rights, which were trumpeted maybe 10 years ago, are no longer in the development discourse. And the sole focus is on ease of doing business. Nothing wrong. We need business. We need to generate wealth to spread it. But we can't neglect human development. And that is what has been revealed during the COVID. Public health, education, and the public sector, not just public health. The public sector has been consciously neglected. And then there has been an informalization of labor, which people spoke about, but was not taken very seriously till the migrant crisis hit. And another thing which has huge consequences, the forced formalization of the informal economy through technology and tax, but not through production technology, skilling, and improved management. We thought that's the best way to formalize, but you cast them in all kinds of IT traps and push them. Then labor laws have weakened. Probably I've not studied the labor code in detail, but whatever little I hear about it or read about it, it's not a great thing. And we all know trade unions are confined to the formal sector. Sonia would agree with me. And judicial activism is on the decline, but it reached the worst. Probably the worst is over during the initial days of COVID. But now it seems to have regained quite a bit of a huge loss of image and loss of credibility and loss of trust it suffered maybe in 2019 and 20. But another thing which goes unnoticed is the killing of the plan. India did have a great planning system, but it involved discussion with academics, civil society, officials, and some kind of rational competition for resources and an allocation of resources based on some priority which is more transparent. Now we killed it. So the scheduled caste subplan, the tribal subplan, and the plan provision for persons with disabilities, all this are no longer there or are there in an attenuated form which can't easily be done. And of course, the local governance system is unusually weak in a country like India. And sometimes the huge, which worries all of us, the class interests and communal interests cancelling the positives. That's a very dangerous thing. But another dangerous thing, which you all know, is a shrinking space for civil society action and also independent media. So it's not a very healthy scenario which we are facing, or we were facing, and we are still facing. And COVID unmasked several realities. As I said, poor were locked out of employment. I'm a student of English literature, and in King Lear, I studied more than 45 years back, that King Lear saw clearly when he was blinded. Now that we are in that state, probably we can see clearly the value of agriculture, reappraisal of the concept of migrant employment. But we have also realized their critical contribution to the economy. And most importantly, the criticality of MSME and particularly the M and S, the micro and small, and the value of local governments. One of the positive features, I can't use the word positive in this context, of COVID was the coalition of Gram Panchayats, self-help groups, and local voluntary organizations or civil society organizations. The worst days of COVID in phase 1 and wave 1 and wave 2, they pushed it even in the most remote parts of the country where Panchayat Raj institutions are quite weak. But still, it ultimately, when everybody ran away, it's a Panchayat which held forth, and they formed a coalition with the SSGs supported with this. Probably the uncertainty and fear has gone now, but the uncertainty is very much there. Loss of non-farm jobs. But one thing which is not much discussed, there have been a lot of studies in India, particularly I've read the early studies by Anirudh Krishna, a civil servant who joined the Duke University, probably is still there, which says that it's easy to slip into poverty. But once you slip into poverty, coming back is very difficult. So now the recent studies show that a lot of people have slipped into poverty. So all the gains we have made in the last 2 decades would go waste. And we really have to struggle to bring them back. So the focus should be on those who slipped into poverty. The word precariat, which has been used quite frequently in the last few months, though it is there a long time. So it's not just kickstarting the economy, it is healing, caring, and nursing the economy back to health, which of course needs a lot of confidence building. The immediate action, of course, that has been the same thing has been there for the last 1 year, the survival focus, so that you communicate with the poorest, give them an assurance, reach out to them, and provide them with the basics. Even the Professor Sunny's slide showed that not all of them have got the free rations. So they'll hunger, health, and social security. Start with it. And then the entitlements which are already there, not new entitlements. Food, work, pensions, and some services. Health services are very badly hit. Restoring them would be the most important. As is mentioned, and as has been proved in the country, MGNREGs, which has been criticized left and right by all sections of the political thing as a useless scheme and all that, but suddenly it saved India. Agriculture and Narega saved India during COVID, saved in with underlying. So now MGNREGs again is shrinking, dues and all that we are reading in the papers. So MGNREGs should be the centerpiece of a revival. I'm mentioning only the poor, not the other kind of just about the poor, focusing on the poor and no rationing. And probably instead of 100, at least till the economy comes back, we can give about 150 days. That should be really doing. In the agriculture sector, which has been doing well, in spite of farmers' agitation, it seems to be doing even now, though we really don't know the impact of the unseasonal rains now. But something which, for the revival, the concept of skilling the agriculture labor and skilling the farm, it was never discussed. There have been isolated instances here and there where by skilling the farmer and skilling the agriculture laborer, you can increase productivity by up to 10%. So it's a huge bonanza, and skilling them is not very costly. And using the self-help groups, they are poor women, they will not have land, but the thing which is piloted in Kerala mostly, the so-called group farming, not collective farming. They come together and take lease land and do this. And they can serve as a kind of almost like a business proposition, that on a turnkey, you can do agriculture services for people who have more land. Thereby, with little bit of mechanization, earn a lot. And agriculture also will get stimulus. Credit, of course, is very, very critical. Though we said that we are going to be very liberal with credit, but I'm not sure it treats agriculture the way it should. Something I see a great promise is agroecological farming. There's a lot of criticism, and I saw a lot of uninformed criticism, even in a state like Kerala, saying that it is Hindutva farming. Agroecological farming is postmodern farming, where we, without, while like Sri Lanka is cited as a model for a hasty rush into organic or green farming, and the thing going back, but not a very graduated thing is certainly going to help. It will restore the soil and even probably has a positive impact in climate change, particularly in your nutrition and personal health of the small farmer. Then, of course, the whole issue of how do you organize agriculture? And there, of course, very interesting possibilities emerge with the food farmer producer organizations, not necessarily companies. I can only theorize, saying that if you learn the good practices of self-help groups, so the producer group is not a society or a company, they are essentially like an SHG, and then learn lessons from AMIL so that the upward thing will be more on AMIL, which means the farmer owns and the processing and the chain is pushed by professionals. And we have been reading about AMIL recently and Varghese Kurian's centenary. So it's time to look at that. Replicating it in agriculture is very, very important. Now, coming to migrants, probably many of them have gone back. So now little more formalized. Like in the initial days of West Asian migration, people didn't look at it, but after some time, the embassies started registering, and it has improved. So like that helped us counseling them and liaising with their destination states, and also trying to skill locally and absorb as many people in the local economy. That could be done. It's not easy. I personally handled this program when I was in the Ministry of Rural Development for 3 years as the Additional Secretary and briefly as the Secretary. But I strongly feel that we need to see these migrants as a new target group for our schemes. Not just welfare schemes, look at them as a target group for improved conditions. And we have an SDG called decent work. So that is the thing we need to look into. It's a very, very important kind of thing. And looking at the value addition possibilities leading to micro enterprises, local marketing and manufacturing for an assured market. Initially for an assured market will do, and then clustering rural areas. At one point of time, when Mr. Manishankar Iyer came out with the idea of one block and one product. So that is a rural business hub, it was called. Probably it has greater relevance now. And another thing, a fabulous idea, which I thought is a real, would be a real game changer, propounded by Dr. Abdul Kalam, is that Pura is not providing urban amenities. The expansion is like that. It is converting your village, the 10 villages, into a nucleus with ideal population levels for different kind of things. So, and then the Gandhian concept of a market, which is local first and then outward. Initially, we all thought that is too airy-fairy thing, which will not work. But now we have realized the local market is very important. Now, everybody, earlier they said the value chain, you can go all over the world. But now they are saying many things have to be local, not in a negative sense, but in a positive sense. So the local market and direct marketing is something which needs to push, in a sense, the Gandhian kind of thing. And how do you finance this? MGNRGS certainly needs an urban component. And Jean Dres has come out with a very good thing. Asim Premji University has come out with a very workable. It's not too costly. It will certainly help the migrants and other poor. But ultimately, I see this as a combination, what is called Gram Panchayat Development Plan, what is called People's Plan in Kerala, and the National Livelihoods Mission. So it's a kind of Kudumbashree Panchayat combination we see in Kerala being expanded to the national level. In India, there are nearly 80 lakh SHGs, and many of the Central Indian states are fairly good SHGs. The South Indian states have outstanding kind of thing. So when they come together, it will be mutually beneficial. So let me conclude. Ultimately, we need an anti-poverty plan at the local level, or better call it livelihoods plan. And most important lesson of livelihood is public health is the most important livelihood activity. So earlier we thought thrift and credit and all that, but public health is probably the foundation of livelihoods. Of course, education was always considered as important to livelihoods, plus of course all the activities which I mentioned can take, and we can draw great lessons from the Amul experiment and the women's agency, the SHGs. So these are my thoughts to share with you on reviving livelihoods in this situation. Thank you.
Thank you very much, S.M. Vijayanan, sir. And here, Professor S.M. Vijayanan has been one of the foremost pro-people policy practitioners of this country. And, there are civil servants like him within the system really became activists to, strengthen, as he said, local self-governance, self-help groups, livelihood missions. And he has come out with an excellent set of analysis with policy proposal. And I'm sure that some of those policy proposals would really help. And there is a combination where Professor Sunny Jose very clearly said, what saved the country from an utter disaster was, the Mahatma Gandhi National Rural Employment Guarantee Act and PDS. And also what Vijayansa said about the agriculture. And actually, I have seen this, very, very closely. I've been working in the last couple of years at the grassroots with the people. And we have a very clear case where soon after the flood, we work in a Dalit colony in Aramula block, Erikad, colony, where, most of the people were, doing small agriculture, with 5 cents, 3 cents, etc. And the flood took away everything. And then we have also done a livelihood initiative. And what we noticed there, as well as in my village, where our, initiative, Bodhigram, has also collective farming, as he rightly said. We have found that this, in the first, phase, there was an increasing stress on farming. Actually, I have seen there is an increasing farming of tapioca for the first time in Kerala. Even I have done that. So the point about it is the, fallow lands were beginning to be used. And even, around, there is a group of 15 women farming the land in Bodhigram farm. And we have also done a survey saying that, it helped them on nutrition and also, and they have increased the input. And many of them actually use cow dung and other, organic material. So the point is very clear. There is no alternative to the local democracy, local economy, local sustainable agriculture, and localization of PDS. And as he's rightly said, it's important to also ensure rights-based approach, entitlement, where the migrant workers, both from the source as well as coming, feel dignified and they are also being taken care. Thank you very much. We have a number of eminent participants,
I'll stay for a brief question and answer because I have to leave for some other thing.
So if we have any questions, Dr. Sambat Kala is there from Tata Institute of Social Science, who also has worked on this, JB Rajan and many others. If you have specific questions to the presentation, please, ask S.M. Vijayanan. The floor is open. Also, if you can also complement some of those points which he said. Questions, comments, responses.
Sir, while highlighting
John,
Yeah,
Yeah,
and, Rajan,
first,
Professor Rajan,
there are two questions. First is
Okay,
Sambat,
I'll come again. Yeah.
Sambat and then JB Rajesh.
Okay, yes,
Okay.
yeah.
Yeah.
Okay, yes. Thank you very much for this wonderful, I think, the talk by Professor Vidyanand and both. And it helps us in terms of understanding the various macro realities and micro level intervention also. And with the help of your, I think, the initiatives working with the marginalized communities in various parts of our country. Yeah, but mostly what happens in the urban areas also. I would like to know that what are the direct impacts on the marginalized, okay, in terms of slum dwellers and other people, those who are living in the slums. Like Pune, for example, 40% of the people lives in slums, or Bombay, or various other metropolitan cities and things like that. What are the direct implications of this COVID-19 on their nutrition or their health services, or the kind of maybe their daily, I think, the wage and their services and things like that. So in the context of urban things that I would like to know from the Vijayan sir, because the local urban self and urban both, okay, this has been very important for our country's democracy has been strengthened so far. Yeah. Sir, please.
Yeah.
Thank
And
you.
we'll take
of
one more
course.
question.
Yeah, then
yeah.
Professor Rajan can ask, and then I'll answer.
Yeah.
Sir,
Yes,
the issues are well highlighted, and always we glorify the local governments, especially in the context of COVID-19. We know that the state of Kerala has did well, and also many other states like Odisha, Punjab, they have Sarpanch and all, they are very active. But one thing that is missing, especially in the context of Kerala situation, is that we are not attempting to understand the pain and the stress that has been taken by the elected representatives and officials of local government. I think that need, of course, maybe from the informal interaction and all that, we could understand the level at which they worked and the kind of stress and strain that they have faced. But those things are not exposed to well. And at the same time, there are the responsibilities of many other departments also they are shouldering. For example, in the context of Kerala, Labor Department is supposed to maintain the data of migrants, but they didn't have. So ultimately, Gram Panchayat have done a quick survey and given the data of migrants, and also they spotted the migrant settlement and all that. Similarly, in the disaster management situation, it is the revenue. They have more power with all these things, but they were so silent, and their responsibilities were also shouldered by the local government. But the staff is not transferred, especially in the context of pandemic. That would have been taken place, but that has not taken place. So I think that it is high time to think of a second decentralization, not in terms of amendment to constitution and all that, but in terms of identifying third tier of government as the local self-government and giving all sort of support in terms of other legislative amendment, in terms of resources and supporting mechanisms.
Vijayan sir,
Yes.
just one more point I just wanted to ask you. What I have noticed is poor, and there is a section called vulnerable middle class. These are the people who used to get around 30,000 to 40,000 rupees a month. All of a sudden they close the shops, and many of them are, we have done a quick survey where I live in the village, especially with our own members, around 300 women, and many of them are indebted. You see, the problem is there are things like Muthoot, Insaf, and all of them are coming 5,000, 10,000, 20,000 rupees. And there is a debt of the, vulnerable middle class. Those who are also, you can say that, they are not the poorest of the poor. A section, so the debt, burden has increased with the people as well, not the government. So you are sort of response to that? Is there any study or analysis being done? Yeah,
First,
fine.
I will go to the urban. I fully agree with you. Urban people have suffered more than the rural people. Rural people at least had agriculture and Narega. Urban slums had nothing. Even in Delhi and others, towns, even people who are going and working as housemaids were not allowed for at least 4 or 5 months. So they lost the total livelihoods. Maybe they survived due to a little bit of the PDS system. And as was mentioned by Mr. John, some informal borrowings. So if you look at this really hard hit, the urban poor, particularly those living in slums, seem to have been hit more. Now coming to this third question, indebtedness has increased. That also more in urban areas than in rural areas, has increased. Particularly not that the poorest of the poor didn't borrow, they couldn't borrow. And this, so unless the economy revives, these people were involved mostly in the micro or informal sector. If that revives, probably the services also in Kerala, mostly the services, the taxi driver, auto driver, all the other services. If that revives, only these people can come back. But I agree with you, they are not seen by the policymakers as an important target group because the focus is on the poorest of the poor. Coming to Professor Rajan's question, I agree with you. The local governments bore the brunt, not only during, in Kerala, not only during COVID, but during the floods also. All over India, even states which are very, very weak panchayats, they became the friend line of governance. That is a positive thing because people had written off panchayats in most parts of India. Now that local governance has an innate strength that was revealed, and I see it as positive. Of course, they were overburdened. I mean, at least in Kerala, you pay them a small honorarium. In the rest of India, nothing. They just went voluntarily and worked for about 9-10 months and really suffered with hardly any money. Here, at least you have the money. So that way, I say, I agree with you. We need a little more a second decentralization because local governments have proved themselves beyond beyond expectations. And I agree with you, even in Kerala, they are not given a formal role in disaster management, though they have become the first responders automatically. And I could see departments in charge, as you said, revenue and all that, actually withdrawing and leaving everything to the panchayats, but keeping the resources with them. That is really unfair. Hopefully, but I find the local governments are not very vocal, even in Kerala. But I remember when I was there, I used to be kept on my toes by the local government associations, raising so many practical issues, not agitating, practical issues, and we had to respond. But now I find them very, very silent. I don't know the reason. Unless they are able to bring this out, nobody will listen. Okay.
Thank you, sir.
Thank you, sir, for the
Thank you.
wonderful presentation and response. Now, may I request Dr. Sonia
So
George?
I'll take leave now. I have to some
Yeah,
other work.
yes.
Thank you.
Yes,
Bye.
sir. Thank you, sir. Dr. Sonia George, the leader of Self-Employment Women's Association, and she has direct experience of working in the urban area with the informal sector as well as also the women workers. And may I request Dr. Sonia George to make the presentation.
Thank you, John, for inviting me to this webinar. And I'm extremely thankful to Jan sir and also Dr. Sani on this very meaningful presentations on the topic that we are discussing now. Maybe understanding and accepting what they have discussed or put forward in the discussion, I would like to bring certain, maybe the same, but maybe through other lens, the realities post-COVID or present COVID situations that we are facing all over the country and also in the state. Informality that we have heard from both the presentations, that no, the informality, the conditions of informality, precarity, all those words we have heard repeatedly from the presentations. And of course, the majority of the workforce in India, they are informal workers, and informality means the amount of informality have increased during the COVID situation. That is what the data that are available from different sources like Simpremji or ActionAid or January's or whatever studies are available that are showing us in the context. So my first point that I would like to put before you is India as a country, or the labor or livelihood scenario of the state has never put forward the importance or the significance of the informal sector in this country as the main contributors of the economy or the sustenance of the majority of the people in this country. So it has no such framework. So that has become evident in the process of, means that is what Vijayan sir also said. It has, the COVID has unmasked these realities back and forth. Means it started with the migrants, the issues of the migrants. Means we cannot hear a discussion on livelihoods or loss of livelihoods or post-COVID situation without mentioning the issues, the plight of the migrants in the country. So starting from the migrants, it has exposed the realities of different people in the informal economy, like the domestic workers, street vendors, forest producers, home-based workers, or whoever it is, means as part of the informality. And there are a lot of specificities. That is what I think these specificities of the workforce, means which we were trying to address before COVID, how it has become intensified in the COVID situation, especially in the new normal situations. Means the new normal realities of the workforce is something that we have to understand in detail. For example, let me start with the workspace. We are very familiar with workspaces, which are formal workspaces, and the entire laws, policies, norms of the state, or the basic normativity of this country is based on this formal work relationships. That means where there is a fixed employer, where there is a common employer, and there is a common workplace, a kind of employment relationships that is existing between these two parties. And sometimes the so-called tripartite relations are coming into existence. But when you look at the COVID, as Vijayan sir and also Sambat sir also explained, what happened to the urban scenario of this country, what happened to the rural scenario of the country. Majority of the domestic workers became unemployed. Means they were asked not to come to work because it is generally spread that they were the carriers of virus at the first phase. That is something that we have heard. And second, reality. That means majority of an urban employment situation is being lost because of that. The same is with migrant workers who have come from different parts of the country and stayed in particular states of the country, urban oriented states of the country, and they were forced to go back the next day of the lockdown, and we have seen the plight of these migrant workers in the country. So left out of or thrown out of the workspace. That is the reality, and we are talking about new normal. And the third, when you go to the rural, again, of course, agriculture sustained us, but at the same time, we should see that 3 days back, the farmers in the country, they have been staying, in the borders of Delhi for 377 days and struggling hard, to withdraw the anti-farm or farm laws, and the success of that wonderful, that extremely significant resistance movement in the country that we have seen. So how could we look at agricultural sector in the country in the context of these activities that have been going simultaneously, parallelly, in the midst of the pandemic? So that is what was happening. And majority of the manufacturing, majority of the local production, majority of the supply chains, that have been transferred to the lower tiers of the Indian economy, of the Indian workforce, and homes have become converted into workplaces in majority of the cases. So we may refer to them as home-based workers. Majority of the home-based workers, it's not only loss of work, it's like that the entire burden of the household, where majority of these workers were women, are women, the entire burden of the household had been transferred to these women workers who were otherwise sitting and working at home. So when you look at the existing scenario, for example, when you look at workforce participation, the latest periodic labor force survey also says that India has not beyond 20% or 20.8% of labor force participation of women in this country. And this is the contradiction that we see, the lowering labor force participation before and after COVID. COVID has clearly mentioning that no, 2/3 of the women who have lost employment during COVID have not come back in the recovery stage to the labor market. They are still out of the labor market. That is all important survey agencies like CMI and all are telling us, no, women have not come back to the labor force. The kind of violence that have increased during the course of COVID, the pandemic, where people had to concentrate in the spaces. Home means home is a luxury for how many percentage of people in this country, means people staying with one room, including kitchen and all their lecture activities being performed in the kitchen. This is what the home-based workers work to. So this was the kind of home that we have to imagine when we talk about confining to home as part of the lockdown. So that made the situation more vulnerable in terms of attending to the increased household responsibilities for the women workers, apart from the job loss and the kind of strain and stress that they have to take within the family. So this has become the new normal reality of the country, new normal workspaces of the country. Because if you talk about street vendors, another reality means they were the first ones who were asked to shut down as part of the COVID protocol. Until now, the real coming back or return or recovery stage of street vendors have not happened anywhere. So we are talking about the majority of the workforce who are contributing to the economy and what had happened to them during this new normal process. So I think at this stage, it is important for us to think about the workspaces which the new normal has exposed in detail, means what is happening to the workspace, what are the kind of employment relationships that is happening in this workspace, and how could livelihood be sustained? Because many of these people that we were mentioning, they are not employed category. They could be thought about as self-employed, income generating people running own account enterprises, and part of small MSMEs that we can mention, micro enterprises, and majority of them. So the labor laws existing in this country never support them. None of the social security measures existing in the country, apart from the food, as Sunny sir has explained, the food supplies, the PDS supplies. Other than that, there were no such kind of social security support apart from 1,000 rupees or 2,000 rupees that the government had distributed through different welfare boards. So there were no source of social security for most of these workers. Employers had never taken any responsibility to sustain these workers during this period. So I think this system, this vulnerable condition raises very serious questions. How could you answer, or how could you be responsible for the livelihood mechanisms, including workplace, workspace, and working relations to the majority of the workers in the country? Is the existing normative situation is responsible or is smart enough to address the issues of these workers in the existing level? Is this can we rely on this situation to understand or to consider the resilience package that we are thinking about, the recovery system, status, stimulus packages that we are thinking about? Our experiences, this is not possible to think about in that process. For example, again, such a situation comes, even as part of third wave or flood or any kind of such emergencies, means what the system, is there any thought in the either in the academia, or we have seen there are many studies that have come up. They are coming up with real data. But what are the kind of thoughts that academia had put in this process? What are the kind of thoughts now the planning process in the country, the bureaucracy had put into this process? What had the kind of thoughts the entire state machineries have put into this process to recover or to give support to such people where they are the majority and where they are the people who are really sustaining the entire food system, the entire labor system, the entire livelihood system in this country? People who are working as part of the commons, that is something that we have to address. The fish workers, the forest producers, the people who are engaged in land, means all those people who are part of the commons. That is something that again we have to think. They don't have any such kind of sustainable sustenance mechanism that has been formulated years after years. People, means we have seen that government may introduce little social security like 1,000 or 10,000 rupees, food grains through PDS. Apart from that, there is no sustainable livelihood. Apart from debts we have discussed. The kind of debts, the government even was, I would like to explain, put your attention to one of the schemes that government had brought in terms of support mechanism for the street vendors in the country. There was a scheme called PM Swanidhi that was introduced during the time of lockdown for the street vendors in the countries. They had to register in the scheme through attaching their Aadhaar and phone numbers and all, bank accounts and all. And in the start, they'll be provided with 10,000 as debt. When they pay back, they'll be getting next installment. That means most of what had happened in the course of time is that most of the vendors who had taken this first installment, followed by the second lockdown, completely their entire livelihood system was closed and they were not able to pay the money. It had affected their bank capacity, their debt had been increased in the banks. It is reflecting on their CIBIL scores. Their entire activities have been monitored by this loan or debt recovery process by the central scheme that has been introduced as part of COVID recovery. So who in the country is constantly monitoring the system? Is there any constant monitoring system so that this kind of mechanisms are clearly addressed and how it works against the poor informal workers of this country, how it is affecting the most vulnerable sections like women, the Dalits, the Adivasis of this country? Now, when you talk about migration, when you look at the roots of migration, majority of the people who migrate are from the tribal villages of India. They are coming from rich resource land, forest background, that is the history, and they are forced to migrate due to displacement, due to anti-people development, anti-environmental development policies. All these are affecting the migration that is increasing day by day in this country. Is there any system? Now the government had come up with this Eastern portal to address or to register the entire working informal people of this country. But we suspect that that is again going to curtail the movements, that is again going to what we call track their movements in the process of, in the name of social security, that in terms on the basis of religion, on the basis of communities. This is going, means the government will have the data and they know how to reproduce the data into different forms, and that is the danger that we are looking forward, unless and until there are no proper methodologies that have been developed at the source and destination levels. We talk so much on destination states, but none of the policies talk on states where they are coming from. How could there be a combination of relationships, a memorandum of understanding between the source and destination? Is there any such relationship possible? We are talking about portability of ration cards, we are talking about portability of social security, but nobody has thought in this country how this is possible. How it would start from the source states, when it reached the destination states. What is the responsibility of the destination government to the state government in terms of the workers that they produce in the state, for the labor, for the it is all contribution to the economy of the state or for the country that we are speaking about. Unless and until these mechanisms are not formulated, and in between we have seen the weakening of the labor laws. The Interstate Migrant Workers Act is going to get repealed soon when the Occupational Safety Code is coming into existence. So likewise, the Unorganized Sector Social Security Act is going to repeal when the Social Security Code is coming into existence. So many of the significant acts that supported these workers in the country are going to vanish. And with this beginning of the labor relationships, these workers who are trying to earn their living conditions, we talk about minimum wages. Now we have seen that minimum wages have been replaced by minimum floor wages. So that means the remunerations are decreasing for the workers who are in the lowest tier and who are the majority of the workers in the country. That means that is going to weaken when the floor wage concept is coming to existence. And income of the people, we have seen always, we talk about income. Kerala state has a lot of discussions on bringing through the self-help group concept that Vijay and sir was saying, bringing women into the forefront of agriculture or protection or whatever it is. But when you look at the data, when you look at the income generated as part for the self-existence of the workers who are involved in it, it is below the floor wage even that women are getting income. That is, the Kerala state is progressing at the cheap labor of the women who are performing this. For example, we can see that now people are totally speaking about the Janagiya hotels. That is people's hotels. That where meals are being offered by 20 rupees. Who can afford 20 rupee meal at this stage of this much cost rise in of vegetables or provisions or whatever it is? Because women are ready to give free labor in order to support the state policies. So this is one of the danger that we have to look at in this process. So everything being considered in the name of sustaining informal economy will be at the cost of the vulnerable communities. Patriarchy, caste, and community relationships play a very major role in determining these relationships, and there is no collective bargaining. Self-help groups have no collective bargaining. We don't have to bargain collectively in a self-help group program. It is a mutual support formula. We don't have to collectively bargain in a small enterprises because we are beyond, or we are out of the labor laws. So we don't have to, means there is no such support. And the state is so much, the entire situation is so much speaking about the knowledge economy. So who is going to support the knowledge economy when it scatters the workers from the entire rights that have been offered through different laws and different collective bargaining mechanisms that have been developed in the state over the years? Nobody is speaking about that. So I think at this stage, it is very important when we talk about recovery, when we talk about resilience, it is important to consider the resource, access to income, access to sustainable livelihoods in the new normal space, where these are the spaces. It could be a public market, it could be a roadside vending space, it could be a leased land, it could be an ocean or sea, it could be a common pond, it could be a forest. These are all the possibilities of livelihood in this country. How are we going to regulate these processes, labor relationships, working relationships, considering the person who are laboring are the most important persons in the country, like the women, means the care of the women, the care economy contribution of the women, that is not being considered at any levels. Now, I'm not talking really only about the unpaid work, but the paid work that women had to do in order to sustain the unpaid care economy of the family. Now, these contradictions are not addressed in this livelihood regulation in the state, in the state or in the country. So these are all concerns for us. And of course, we talk about local government. Of course, local government, generation of the local economy, it has a great role in supporting the present situation or addressing the present situation, but it has to be the normative of the discourse should be changed. Without changing the normative of the discourse, it is not going to support the poorest of the poor, the vulnerable groups, the gender relation. It is not going to address the gender relations. It is not going to address the caste or relations. So that is something that we have to be the recovery process, or while we are thinking about that is something we are put forward in the process for a sustainable or for an inclusive growth, inclusive existence of all the people with a sustainable livelihood formula. Thank you so much.
Thank you very much, Sonia, for that excellent presentation. And particularly, you have made some very, very important, points. These days, home-based work is a new normal, but, for the women, self-employed women, home-based work has been a reality much before the COVID. And also you have very clearly said how workspace itself is engendered, and, how patriarchy and caste operates even in the question of self-help groups. And you also said about the contradictions, how the government sponsored programs actually is also in a way reinforces the inequalities, and cheap labor. One of the most important thing you also mentioned about this is, even prior to COVID, existing gender inequalities at workspace in terms of labor relationships, informalization of labor, all of them got exacerbated and came into the forefront. And you have given that fantastic presentation, I'm sure based on your own direct experience of working with labor, informal sector, street vendors, and home-based workers. Thank you very much for that very important thing. And one of the most important things you also said, I hope in the response you would say, the violence, not many people have done, while we are talking about all the self-help groups and all the good things, etc., and the burden and the violence which happened during the COVID pandemic is also something which we need to, take into consideration at all level, and how it really affected the, food security, nutrition, all of them, which we said affect women more than, others. So thank you very much. And we are opening it for questions, comments, and responses. Please.
Hello.
Yes.
John,
Yeah, Sunny.
I have an observation.
Yeah.
Okay, so one of the important points that Sonia has referred to is actually which came out very clearly what I call the centrality of care work. Because the COVID pandemics very clearly revealed that how central that the work normally we say that women do is actually not women's work. The care work is central to the survival and sustenance of the family. But unfortunately, if we look at both at the empirical level, that hardly about 20% of men participate in doing anything very effectively in paid work. In fact, what they call they help, not participate. And second, the kind of the value attached to care work is actually very rigorous. So it is time that we actually relook at the centrality of the care work and the kind of value attached to care work in the future time, because in the days to come, because now we have become a new normal, online education and so on and so forth, where somebody has to really attend to the children. Somebody has to take care of the well-being of the children, which they alone cannot take care of that. So it is actually the one of the most important observations that came up during this is actually that the centrality of care work. Thank you.
I just wanted to add that, Sunny, one of the most important thing I have seen here, the role of care workers, ASHA workers, the frontline people, both in terms of COVID, responses as well as vaccination. I've personally seen this in a very, very tremendous way. So that also, and the fact of the matter is almost, everyone who were at the forefront were women. in terms of COVID response and management. That's also
Absolutely,
very,
absolutely. I fully
very,
agree.
very important. And it's not only in terms of the beginning, in terms of giving food, is most of the time. I remember when the community kitchen was done, we were also running community kitchen, etc. Mostly it's the women who gave everything. So that was also needs to be, and it's the most of them happen to be poor women, not the well-off. Of course, the government employees, etc., also done it, but the role of care workers is fundamental. Thank you. Other Asaira.
Yes, sir. So this is Sarah. I'm a postgraduate student in political science from Central University of Kerala. My question is to Sonia ma'am. I just wanted to know that since I would like to know what are the pressing needs to keep the micro enterprises like this Seva and many other organizations to keep this business running. So what are the pressing needs to keep the micro enterprises, this business running? Another one I would like to know is that are some occupations like the members of Seva, are they experiencing severe hardships as compared to many other jobs? And what are the immediate challenges and vulnerabilities faced by them? That's it.
Thank you. Any other questions? Comments? Any questions? Okay. Now, I will request Sonia.
Yeah. Thank you for raising that question, Sarah, and also Sunny sir on raising the issue of care economy. How could we develop the issues of care in a country like India? Means I think care economy itself has become a big, a heavy discourse, in the entire world. Globally, it has discussed. But I think when it comes to India, I think we have to develop an alternative framework to address issues of care, as John has said on the frontline workers. Means they are still considered as volunteers. They are not even recognized as workers in this country. So they don't have majority of the workers, except in state like Kerala or Andhra or one or two states. All other states offer them very little honorarium as part of the frontline work that they are doing. Means the risk work that they have undertaken even during the COVID, and also the care in terms of the paid unpaid debate that has to come to the forefront of our discussions when we have measurements of productivity, measurements of labor participation. As you have rightly pointed out, when we talk about all of this that women perform, the labor force participation survey says that only 20% of female workers are involved in economy. That is where I was trying to say, the new normal situation has exposed these realities where the so-called work that women are undertaking, performing as part of rural livelihood missions or urban livelihood mission as part of supply chains. Majority of the workers who are home-based workers, they are not into any of these enumerative process that is coming up, because they are considered as housewives in the process. That means they are not included in the labor force surveys of the country. That is a big methodological error that still follows, because this methodology is not a quantitative error, it is a qualitative error, because women who are sitting at home, they are just housewives. The women themselves are not taught to answer the question as they are workers. That is something that the country is still lacking in the process, and we have to address it very seriously, both sociologically, economically, and politically. That has to be addressed. Otherwise, this equation of labor force participation will not change. So that is where I think states like Kerala should come up with more innovative methodologies to capture the productivity, capture the measurement of these women who are involved in the labor force, contributing invisibly to the economy. That is something that we have to take when you discuss the economy of care into the centrality of discussions. That is something that is very important. And it has to be surrounded by all the issues that women face, means physically, mentally, emotionally, and all those issues have also to come up in the process. And the second thing on micro enterprises, yeah, there are a lot of issues. Means when you look at if you study, for example, in the context of Kerala, the number of micro enterprises, I have heard from many people who have studied on micro enterprises, and we ourselves have done a study on micro enterprises. Around 90% of the micro enterprises that have started in the course of 20 to 25 years of people planning process, the Kudumashri, and all these employment guarantee activities have not sustained here in the state of Kerala. That is one of the model states in India. It's because main reason for it is maybe the state, maybe some capital or loans are dispersed in the beginning of the program, but there is no such system of developing or mentoring or hand-holding the particular person involved in that particular enterprises as a workforce participation in the country, as a laborer, as an employee in this country, so that they are able to earn, they are able to sustain in the labor market, in the common market, and also to struggle against the odds that is happening as part of different situations. That support is being not offered at any levels. That means their income is not increasing, and so after a few years they'll stop that. So that is something that is happening. So this is one of the biggest challenge that we have to address. What are the circumstances, favorable situations, surroundings that we could develop as part of developing a micro enterprise? That is something very valid that we have to think about. And also that I have been saying about all these workers, majority of the workers like domestic workers, street vendors, fish vendors, all those home-based workers, all of them have lost livelihoods. As part of recovery, we could say that a domestic worker means this is like, we cannot even brand people as one sectoral representation. A domestic worker at the same time, she can be a street vendor, she can be a home-based worker, she can be a tailor, or she can do some other work also in the community to earn a livelihood. Means multiplicity of jobs, multiplicity of identities of a worker to earn a livelihood. That is the peculiar situation of India. So that multiplicity means, for example, a domestic worker who earned from 5 houses now means to an extent only one house they are allowed to work in because of the COVID situation. Means income from the 4 houses is lost. Who is going to calculate this income loss at that level? So this kind of micro level calculations, micro level complexities are not addressed in the process. That means it is not being counted in the recovery process also. So that is affecting in the long term the life and livelihoods of these poor people who are the majority of the workforce. That is our understanding, our experience of working all over the country during the COVID time, and that is a very serious issue that we have to look at.
Thank you very much, Sonia. And thank you very much, Professor Sunny Jose, and thank you very much, S.M. Vijayanand. We had excellent presentations bringing different dimensions of livelihood, marginalizations, poverty, and all of them also shows how inequality existing in the society even prior to COVID, how these inequalities reinforced the existing inequalities during COVID, and how it marginalized women more than others. And, it has a caste dimension as well. Most of the people, if you really see, among the migrant workers, most of them happen to be Adivasis, Dalits, women, and people from the marginalized sector. So this, in Indian case, it is not just numbers, it was also caste. There's also gender, and the social economic inequality is also a sign of political inequality. And while we mentioned about agriculture, let's not forget one fact. It is during this pandemic, one of the biggest and the most pertinent struggle happened in India. Anywhere in the world, the I was looking at the struggles. There were lots of protests in many parts, but the farmer struggle in India, raised very, very important questions about even the agriculture and how the corporatization of agriculture and informalization of labor, etc., create problems not only for the farming class but also for the poor and the marginalized. So that is also something which I would like to raise. It is the COVID. During the COVID time, the struggle for democracy, the struggle for rights, were also something which we need to take into consideration. Thank you very much for this very good presentation. We would definitely take the facts, figures, empirical analysis, perspectives, which three of the eminent panelists gave in our study and analysis. We hope to take this forward. The next in the series is the COVID, the impact of COVID on public health and public health system. And thank you very much for all of you who participated from different parts of the country, scholars, activists, students, and thank you very much once again for the eminent panelists and all the participants of this webinar. Thank you very much. With this, we would close this webinar. Thank you.
Thank you, John. Thank you so much for the opportunity.
Thank you so much.
Thanks. Yeah, and particularly I would like to thank Rajalakshmi and Avinash who took the initiative to organize this, and also our team who are working on livelihood, our interns team who have been working on livelihood issues. Thank you very much.
Thank you, sir. Thank you.
Thank you.
Okay.